Gross anatomy of thyroid gland. Okay, gross anatomy of thyroid gland. The microscopic structure already we have discussed last week. If you remember, microscopic structure of thyroid parathyroid glands are over. Okay, so today we will be discussing about the gross structure of thyroid gland. Okay, so in gross structure of thyroid gland, same like the any other organs, whatever you have studied. Okay, in the similar way we have to study about the thyroid gland. Okay. Now in the dissection hall, anyone have you seen the thyroid gland? Yes, not entirely, some part of the thyroid gland. I hope you have seen. Okay. So today we will discuss, and when you will be going for dissection, I will request everyone to see whatever we are discussing in the class, so that you can understand, especially the relations. Okay, so we know that the thyroid is an endocrine gland. Okay, thyroid is an endocrine gland. Now, where it is situated? It is situated in the lower part of the neck. Okay, in front and on the side of the neck. Lower part, front, and on the side of the neck. That is the location. Now, exactly if you see the gland, thyroid gland, it is situated deep in between some muscles. That means some muscles are there which are situated superficial to this gland. Okay, and these muscles are sternothyroid and sternothyroid muscle. Can anyone tell me which type of muscles are these? Sternothyroid and sternothyroid. These are infrathyroid muscle. Okay. So already I have shown you the infrared muscle several times we have discussed. So those muscles remain superficial. So deep to that you will see the thyroid gland. Along with that sternocleidomastoid muscle, mostly the anterior border, okay, of the middle part of the sternocleidomastoid muscle is also overlapping the gland. So unless and until you remove these muscles, you will not be able to see the gland properly. Okay, remove means in the sense you have to retract the muscle. Then only we can see the entire gland. So I hope you have noticed that in the dissection hall, you have seen suprahyoid muscle, infrahyoid muscle, then you have seen the submandibular salivary gland. But as a whole, you have not seen the thyroid gland yet. If you have noticed, why you have not seen, क्यों दिखाई नहीं दिया अभी तक? Because these muscles are covering the thyroid gland. Sternocleidomastoid already we have removed, okay, but the infrahyoid muscles are intact. Just I have shown you the origin insertion of infrahyoid muscle, but those are not retracted. Unless and until you retract it, you will not be able to see the thyroid gland. Okay. Next, though it is a endocrine gland, so it is having rich blood supply. Any endocrine gland having rich blood supply. Okay. Next, if you see the gland, what is the location or what is the extent of the gland? From where to where it is extending? It is extending from C5 to T1 vertebra. Okay, C5 to T1 vertebra. Okay, C5 to T1 vertebra, that is the extent of the gland. Fifth cervical vertebra to first thoracic vertebra, that is the vertical extent of the gland. Okay. Now the function of the thyroid gland, as we have discussed earlier, do you remember the functions? First of all, it will regulate the basal metabolic rate, then it affects, or you can say stimulates, the psychic growth, as well as it is having an important role in calcium metabolism. These are some important functions of the thyroid gland. Now, the thyroid gland is situated superficially in the neck. Okay, the thyroid gland is situated superficially in the neck, and palpitation of the thyroid gland is very easy. Okay, that thing will be discussing in the applied part. So easily you can palpate the gland. Now, do you remember last week I have explained some special features, or you can say peculiarities of the thyroid gland? Do you remember what are the peculiarities or some special features of the thyroid gland? What are the special features? First of all, it is only thyroid gland located superficially in the body. Rest all the endocrine glands, these are situated deep in the body. This is one special feature. Next, you can say the thyroid gland depends on external source for production of the hormone. That means, which is the external source? Iodine. Okay, iodine is not produced in our body. We are dependent on whatever we are eating, whatever we are consuming. From there we are getting the iodine. So thyroid gland is depending on that in order to produce the hormone. So that is also a special feature, or you can say peculiarity of this gland. Next, thyroid is the largest endocrine gland of our body, and as I said, it is placed superficially in the neck region so that it can be palpated easily. Okay, and having rich blood supply. So these are some unique features of the thyroid gland. Okay. Next, situation and extent. So, what are the parts of the thyroid gland? Anyone? That I have shown you the diagram before going to the histology. So, it is having two lateral lobes, and both the lateral lobes are connected by isthmus. Okay, that means if you see the shape, it is H-shaped. The thyroid gland, it is H-shaped. Two lateral lobes are there. It is connected by isthmus. Roughly, it is H-shaped. Now, if you see the lateral lobes, the extent of the lateral lobe, okay, from above to below, that lies from C5 to T1 vertebra. Okay, and it is enclosing the upper part of the trachea. Okay, so the lateral lobes, as I said, C5 to T1 level, it is extending and it is enclosing or embracing the upper part of the trachea. Next, if you see the extent, so this particular lobe, lateral lobe extends from the middle of the thyroid cartilage to the 4th or 5th tracheal ring. Middle of the thyroid cartilage to 4th or 5th tracheal ring. That is the vertical extent. Okay. And if you see the isthmus, which is present horizontally, it is extending from 2nd to 4th tracheal ring. Okay, 2nd to 4th tracheal ring. I hope you have studied about the trachea. Gross also we have discussed, and histology also we have discussed. Okay, so do you remember the tracheal rings, C-shaped tracheal rings, right? So I am talking about those tracheal rings. Okay, so this isthmus which is there, it is extending from the 2nd to 4th tracheal rings. Okay, can anyone tell me how many tracheal rings are there approximately? How many tracheal rings are there in the trachea approximately? Anyone? It is approximately 16 to 20 tracheal rings are there in the trachea. Okay. Among them, the isthmus is extending from 2nd to 4th tracheal ring. Okay. Now here in this particular diagram, you can see the location of the thyroid gland. As I said, it is present in the lower part of the neck. That also anterior aspect and laterally. Okay. Next, you can see in the diagram the extent, which is extending from C5 to T1. Okay, C5 to T1, middle of the thyroid cartilage to 4th tracheal ring. See, these are the tracheal rings. These are the tracheal rings. Okay, so that is the location of the thyroid gland. Okay. Now, why you have to understand the location of the thyroid gland? Because unless and until you understand the thyroid gland, when the dissection is done, it will be very difficult to find the thyroid gland. Okay, that's why knowing the location is important. Okay, next the features, external features of the thyroid gland. As I said, it is H-shaped gland. Okay, and two lateral lobes are there connected by an isthmus. Okay, that is the external appearance of the thyroid gland. Now, sometimes a pyramidal lobe is also present from the isthmus. Okay, from the isthmus, a pyramidal lobe is extending upwards. Okay, now sometimes it is present, sometimes it is absent. Okay, next from the pyramidal lobe, a fibromuscular band is extending. Okay, and it is attached to the thyroid bone above. That is called as levator glanduli thyroidea. Okay, levator glanduli thyroidea. It is also coming under external features. Now, each lateral lobe is extending from the oblique line of the thyroid cartilage to 5th to 6th tracheal ring. Okay, already I have mentioned about that. And if you see the dimension of the thyroid gland, each lobe measures 5 into 3 into 2.5 centimeter. Is length, breadth, and thickness. That is the dimension in case of adult. And if you see the isthmus, both are saying 1.25 centimeter. Okay. In an average, the weight of thyroid gland is approximately 25 gram. Okay. On average, the gland weight is 25 gram, but it is larger in female as compared to the male, and further it increases the size during menstruation and pregnancy. Further, the size increases during menstruation and pregnancy. Okay. Now, here you can see the diagram. In this diagram, can you see the parts of the thyroid gland? So, what is this? This is one lateral lobe. This is one lateral lobe. Both the lateral lobes are connected by isthmus. Okay. First point. Second point, as you can see, if you take one lateral lobe, see the extent. It is extending from C5 to T1. Next, this particular part is the middle of the thyroid cartilage up to 4th or 5th tracheal ring. It is the extent of the lateral lobes. Okay. And if you see, this is the isthmus. Now this isthmus is extending. So this is the extent of the isthmus. Okay. The isthmus is extending from 2nd to 4th tracheal rings. Okay. So this is the extent of the isthmus. Next, from the isthmus, you can see a lobe is extending upwards. This is called as pyramidal lobe. And from the pyramidal lobe, a fibromuscular band is attached to the inferior aspect of the thyroid bone. It is called levator glandum thyroideum. Now, occasionally it is present. Every time it is not present. Okay. Along with that, in the diagram, you can see the capsule also, which we are going to discuss in detail about the capsules of the thyroid gland also. Okay. I hope you can see the capsule. Now, I want to ask you one thing. When you have studied about the prostate gland, I know you have studied about the prostate gland. So, when you have studied the prostate gland, at that time, do you remember the capsules of the prostate gland? Okay. Now, why I am asking? Because in case of thyroid and in case of prostate, okay, one difference is there. Now, difference is the position of the venous plexus. Okay, now what is the position of the venous plexus in case of prostate gland, and what is the position of venous plexus in case of thyroid gland? Because during the time of surgical removal of some part or the entire gland, this is very important. That's why you have to know the relation. Okay, so first let's discuss about the capsules, okay, of the thyroid gland, and then we'll see the comparison. Here also one beautiful diagram is there, which you can see the extent of the lateral lobes of the thyroid gland. You can see the pyramidal lobe and the fibromuscular band. Okay. Next is the capsule of the thyroid gland. So in histology also we have discussed that thyroid gland is also having a capsule. Okay. So how many capsules are there in case of thyroid gland? 2 capsules are there, true capsule and false capsule. So how the true capsule is formed? Now you have to understand one thing. True capsule is the inner capsule. False capsule is the outer capsule. Okay. So the true capsule is formed by the condensation of fibrous stroma of the gland. Fibrous stroma का मतलब क्या है? What is the meaning of fibrous stroma? Supporting part. Okay. The supporting part उसका condensation होता है. Then we are getting the inner capsule. Okay. And outer capsule is formed by which fascia? Pretracheal fascia. Okay, outer capsule is formed by the pretracheal fascia. Okay, now there are some speciality in the pretracheal fascia. What is that speciality? Now the pretracheal fascia, if you trace it above and if you trace it below, then what are the findings? Pretracheal fascia is not confined to thyroid gland. Okay, pretracheal fascia is not confined to thyroid gland. It is extending upwards also, downwards also. Okay, so that tracing is very important. So if you trace above, you can see pretracheal fascia. After enclosing the gland, it will touch the thyroid bone in the midline, and laterally it is attaching to the oblique line of the thyroid cartilage. So after enclosing the thyroid gland, if you go above in the midline, it will attach to the thyroid bone, and laterally it is attaching to the oblique line of the thyroid cartilage. Okay. Next, if you trace below, this fascia will enter the thorax and will blend with the apex of fibrous pericardium. Okay, so that is the vertical tracing and inferior tracing of the pretracheal fascia. Okay. Next, this pretracheal fascia, Okay, it is thickened and form ligament of Berry. Anyone have you heard about this ligament of Berry? Now, which particular part is thickened to form the ligament of Berry? The medial surface of the lateral lobe of the gland between the cricoid cartilage. Okay, so medial surface of the gland, okay, and the cricoid cartilage. In between these two structure, the fascia became thickened to form a ligament that is called as ligament of Berry. Okay. Now, due to this attachment, the thyroid gland moves during deglutition or swallowing. Whenever we swallow, at that time you can see a movement is taking place, right? That is called as deglutition. And as I have mentioned, when we will study the pharynx, at that time we will discuss about the stages of deglutition. So during this deglutition, the thyroid gland is also moving. And the question is why it is moving thyroid gland? Because of this attachment. Okay. Now here you can see the diagram. I hope you have seen the diagram earlier when you have studied about the fascia of the deep fascia of the neck. Can you see the pretracheal fascia? Can you see the pretracheal fascia? Now see pretracheal fascia when it is enclosing the gland, thyroid gland. Okay. When it is enclosing the thyroid gland, it is forming false capsule around the thyroid gland, right? Once it is forming the false capsule, you can see it is going upwards. Now, if you trace it upward, in the midline it is attached to the hyoid bone, and laterally it is attached to the oblique line of the thyroid cartilage. Okay. Next, here you can see a small part, okay, which is covering the medial surface of the lateral lobe of the thyroid gland. In between the cricoid cartilage, okay, the fascia got thickened to form a structure that is called as ligament of Berry. Okay, and like this it is attached to the cricoid cartilage. As a result, what will happen whenever a person is swallowing, the thyroid gland is also moving. Okay. So that is about the true and the false capsule. Next, what do you think? What will be present in between the true and false capsule? Yes? No. That was present in case of prostate, but not in this case. The spaces between the true and false capsule is occupied by, first of all, the parathyroid gland along with the posterior border. In between both the capsule, on posterior aspect, we will be getting the parathyroid gland. Okay. Next, venous plexus is there, but the venous plexus is situated deep to the true capsule. Okay, the venous plexus is situated deep to the true capsule. That's why whenever the surgical resection is done, okay, of the thyroid gland, some part of the thyroid gland, the gland is removed with its true capsule. Okay, it can be removed with its true capsule. Why? Because the venous plexus is situated deep to the true capsule. That's why you can remove the true capsule. The venous plexus will not get damaged. Okay, let me show you the diagram. First, concentrate on this diagram. Now, in this diagram, you can see the thyroid gland, then the thyroid veins which are draining the thyroid gland. Okay, and then you can see the true capsule. Okay, and you can see the false capsule, and just see the location of the venous plexus. See the location of the venous plexus. So the here venous plexus is situated deep to the true capsule. Okay, everyone please notice this particular part. So this is the true capsule. This is the false capsule. Okay. Now this is the venous plexus. Venous plexus is situated deep to the true capsule. So if a surgical resection is done, okay, at that time you can remove the true capsule. Though venous plexus is not attached or not directly related to the true capsule, so the capsule can be removed. Okay, it will not cause any damage to the venous plexus. Okay. Next, another diagram is placed over here. Now, this is thyroid gland, capsules of the thyroid gland, and here you can see the capsule of the prostate gland. What is the difference? That's why in the beginning I have asked you. Can you see the difference? Please concentrate in this diagram. Now, this is the thyroid one which I have explained you over here. Okay, now this is the prostate. Now, in case of prostate, you can see the true capsule and false capsule. In between these two, the venous plexus is situated. Okay, and here deep to the true capsule, the venous plexus is situated. Okay, so in case of thyroid gland, when the surgical resection is done, the true capsule can be removed, which cannot be done in case of prostate gland. Okay, that is the difference. Further details we will discuss in applied part. Okay. Next, the most you can say difficult and boring part will start. Okay, from here. Why I am saying this? Any idea? Because this is nothing but the surfaces and borders. If you remember any organ, any structure, whenever you study surfaces and borders, is it interesting? No, I know it is not interesting. Okay, so many surfaces, so many borders are there. Each and every border, each and every surface is having different relation. Okay, so that's why what you have to do, you have to understand the relation. Okay, so this time we'll understand the relation with the help of various diagrams. Okay, and as I said from the beginning, if you know the diagram, you can write the relation from your own. Okay, so don't by heart every relation, it's not possible. But I try to visualize things and try to understand the diagram. So, what will be the parts of this thyroid gland? First of all, we have to take the lateral lobes and then we have to take the isthmus. If you take one lateral lobe, it is roughly pyramidal shaped. If it is pyramidal shaped, then what will happen? If it is pyramidal shaped, then it will be having apex, it will be having a base. And in this case, it is not inverted. Okay, so जो apex होगा ऊपर होगा and base downwards. Okay, so we are having apex and base, that is clear. Next, we are having surfaces. So how many surfaces are there? 3 surfaces are there. What are these? Lateral surface, or also called the superficial surface, then medial surface, which is deep, and then posterolateral surface. Okay, and then 2 borders are there, anterior border and posterior border. These are for only one lateral lobe. Okay, next we are having isthmus. So this middle part which is connecting both the lobes. If you take the isthmus, it is having 2 border, superior border, inferior border, and 2 surfaces, anterior surface and posterior surface. Okay, now let me show you the diagram so that you can understand the surfaces and borders. In order to the surfaces and borders of thyroid gland, okay, you have to see the anterior aspect and posterior aspect of the thyroid gland. नहीं तो समझ में नहीं आएगा borders and surfaces. Is it clear? You can open any book and you can study. First time when you are studying the surfaces and borders for the first time, समझ में नहीं आएगा. Though it is written in the book, okay, but it will be difficult to understand. So that's why what you have to do, you have to take the anterior aspect, image of the anterior aspect and image of the posterior aspect, combine it together, and then see the surfaces and borders, you will understand. Okay. Now what you can see in the image, in the diagram. First of all, can you see the lateral lobes? Can you see both the lateral lobes? Yes. So 2 images are used over here. So this is the diagram of thyroid gland from anterior view. This is from posterior view. Okay. Everyone please pay attention. This is anterior view and this is posterior view. Right. Now in the anterior view, this is one lateral lobe, this is one lateral lobe. Okay. Now in the lateral lobe, first of all, this is the apex and this is the base. So as I said, the anterior lobes, these are roughly pyramidal. So if it is roughly pyramidal, it will be having an apex and it will be having a base, which you can see over here, which you can see in the diagram. Next, what are the borders? What are the surfaces? First you will see the borders. Only 2 borders are there, anterior border and posterior border. Okay. So here you can see from the apex which is coming downwards, this is the anterior border. Okay, and here you can see this is the posterior border. This is the posterior border. Okay, this is also anterior border. So all the borders and surfaces will be same for both the lobes. If anterior border is there in the left lateral, anterior border will be there in the right lateral lobe also. Okay, so these are the borders, 2 borders. Next, can you see the isthmus? Everyone, can you see the isthmus? Yes. In the isthmus, see 2 borders are there. This is the superior border, inferior border. This is the anterior surface, and behind that will be posterior surface. So I hope isthmus is clear, anterior border, posterior border is clear. Next, when you will do the dissection, suppose the body is lying down in supine position. Okay, body is lying down, cadaver, I am talking about the cadaver. When it is lying down in supine position, when you are doing the dissection, after removing the muscles, whatever surface you can see, okay, of the thyroid gland, okay, that is nothing but the lateral or superficial surface. Okay, that is the lateral and superficial surface or superficial surface. So lateral or superficial surface is the largest surface. Okay, next, if you go on the posterior aspect, then you can see this is the posterior lateral surface. See, this is the posterior lateral surface. Okay, so in between the posterior lateral surface and medial surface, you can see this is the posterior border. Next, if you go deep, okay, medially, then this is the medial surface. Okay, so like this, two lobes are present. Okay, two lobes are there. This will be the apex, this will be the base, right? So this surface, whatever you see, what surface is this? Lateral or superficial surface. Okay. Next, if you go posteriorly, like this, if you go posteriorly, then this will be the posterior lateral surface. Okay, and जो अंदर वाला है, which some portion which you can see over here, that is the medial surface. Okay, so that's why understanding the surfaces and borders are very important, or else you will not understand the relation. As I said, three surfaces are there. First of all, when you will see the thyroid gland from the anterior aspect, okay, the surface, whatever you will see, that is the superficial surface or lateral surface. Okay, then if you go posteriorly and laterally, that is the posterior lateral surface. Okay, and from posterior lateral surface, the posterior border will be there. Medial to that, you will be getting the medial surface. Okay, medial surface is the deeper one. Understanding surfaces and borders are very important. Repeatedly I am telling, or else relation, you cannot understand any of the relation. Okay, so here again, let me explain you the borders and surfaces. So borders, it's very easy to identify the anterior border and the posterior border. Surface, this particular part is the lateral or superficial surface. Then here you can see the posterior lateral surface, and this is the medial surface. Now, one thing, if you have noticed that the thyroid glands, okay, it is enclosing the upper part of the trachea. In the beginning I had mentioned, right? Now the part of the trachea which is part of the thyroid gland is adjacent to the trachea, that particular surface will be the medial surface, as you can see in the diagram. So what is this? Anyone? ये क्या है? What is this? This one? Trachea. So this is the anterior view of the trachea. This is the posterior view of the trachea, right? So like this you can understand the thing. So the surface which is adjacent to the trachea, that will be the medial surface. Can you see in the diagram? Please focus over here. What is this? This is trachea. So the surface which is adjacent to the trachea deep, this is the medial surface on both the sides. Okay, so I hope it is clear about the surfaces and borders. If it is clear, next we will go to the relation. Now how to start the relation? Thyroid gland is not alone in the neck region. You have dissected the neck, you have seen the structures, right? So thyroid gland is not situated alone in the neck, other structures are also there. Okay, so how to study the relation? For that, first we will start from the apex, then we will go to the base, then each and every surface, and then each and every border up to isthmus. Okay, can you see the apex, where it up to which level it is extending? Just see the diagram, the extent of the apex. So apex is directed slightly upwards and laterally, not straight, upwards and laterally it is directing. Now if you see the extent, it is extending from the oblique line of the thyroid cartilage. Okay, it is extending up to the oblique line of the thyroid cartilage. where the extent is limited by the attachment of sternothyroid muscle. Okay. See, oblique line of the thyroid cartilage. This is the extent, and it is limited above by the attachment of sternothyroid muscle. Okay. Next, the apex is sandwiched between two muscles. Okay. What are these two muscles? Sandwiched between the inferior constrictor medially and sternothyroid laterally. Okay. These are the two muscles in between that the apex is situated. So apex is sandwiched in between that. Okay. So as a result, if there is any you can say swelling in the apex, okay, it can't go beyond that particular point. Next, if you see the base, so it is extending up to 5 to 6 tracheal ring, which I have shown you just now. Okay, and it is related to the inferior thyroid artery and recurrent laryngeal nerve. Very important relation. Now here you can see the diagram. Can you see the apex? Okay, I have used two diagrams so that you can see the apex. So see, this is the outline of the apex. So here, this is the thyroid cartilage. Okay, this is the cricoid cartilage, and these are the tracheal rings. Right? Now, this is the lateral view of the thyroid cartilage and cricoid cartilage, so that you can see the outline or extent of the apex of thyroid gland, apex of the lateral lobe of the thyroid gland. Okay, so this red color line, it is denoting the red color outline is denoting the extent of the apex. Okay, now see, extent of the apex is extending up to the oblique line. In the oblique line, so many muscles are attached. Okay, among them, the sternothyroid, which is attached over here. Okay, it is not allowing to extend the apex further from this. Okay, next you can see in this particular diagram, the apex which is there, it is sandwiched between these two muscles. Okay, medially you can see inferior constrictor of the pharynx muscle, and laterally you can see sternothyroid muscle is there. So in between these two muscles, the apex is sandwiched, or you can say the apex is present in between that. Okay, so that is the relation for the apex. Okay. Moreover, in the apex, we are getting two important structures, that is the superior thyroid artery and external laryngeal nerve. Okay, these are the two important structures which are related to the apex also. Okay, superior thyroid artery. So this we will discuss with the blood supply of thyroid gland. Okay, next is the base. Okay, next is the base. So base is extending up to 5th to 6th tracheal ring. Okay. So these are the tracheal rings. So it is extending up to 5th to 6th tracheal ring, and the base is related to two important structures. What are they? As you can see, this is the recurrent laryngeal nerve and inferior thyroid artery. Okay, inferior thyroid artery. These are the two structures which are related to the base of the thyroid gland. Okay, so we have seen the apex up to which extent it is present, and it is limited by which muscle, and it is sandwiched in between which two muscle, and then base up to which level it is extending, and it is related to which two structure. Okay, the base is related to, as you can see, recurrent laryngeal nerve and inferior thyroid artery. Okay, so in the beginning I have told you all the relations we'll understand with the help of diagrams, various diagrams. So apex is done, base is done. What about next? Any idea? Apex is done, base is done. Next we'll go to the surfaces. Which is the largest surface? Lateral or superficial surface? This is the largest one. Okay. Now if you see the lateral or superficial surface, it is overlapped by many strap muscles of the neck. Okay. Many strap muscles of the neck. For example, sternothyroid is there, sternohyoid is there. Okay. Then sternocleidomastoid is there, omohyoid is there. So these are the muscles which are overlapping the lateral or superficial surface. That's why in the beginning I have told you, while doing the dissection, till now you have not seen the entire thyroid gland. Why? Because of the presence of this muscle. Unless and until you remove or retract this muscle, you will not be able to see the superficial or lateral surface of the thyroid gland. Okay. So lateral superficial surface is overlapped by sternothyroid, and superior belly of omohyoid, and along with that a small part of sternocleidomastoid is also present. So these are the muscles which are overlapping this superficial surface or the lateral surface. Okay. Next, if you see the medial surface. Now, do you remember the medial surface? What I have mentioned just now about the medial surface? The medial surface is the deep surface which is related adjacent to the trachea. Okay. So that particular surface is having important relation. Okay. And that relation you will be getting two tubes, two nerves, okay, and two muscles. See, two tubes, two muscles, and two nerves. Like this, the relation is divided so that it can become easy for you to understand the medial relation. Okay. So let me show you the medial relation. So here you can see the relations of the medial surface. Okay. Now in this diagram, okay. So what is this? Which structure is this? This is trachea. This one I am talking about this structure. This structure, this is trachea, right? And this is the thyroid cartilage. So this particular view is taken from lateral aspect. Now in the lateral aspect, if this view is taken, so this particular part will be the medial surface. Okay, so medial surface, as you can see, it is related to two cartilage. It is a thyroid cartilage and cricoid cartilage. If you come below, then it is related to trachea, and posteriorly it is related to esophagus, like this, two cartilage, two tubes, and then two muscles are also there, inferior constrictor of the pharynx and cricothyroid muscle. See, this small muscle is present over here. This is the cricothyroid muscle. Okay, and two nerves are also there. One nerve which is situated above, that is the external laryngeal nerve, and another important nerve which is situated below, that is the recurrent laryngeal nerve. Okay, so these are the structures situated on the medial aspect or medial surface of the thyroid gland. Okay, so here diagrams will only save you. Unless and until you understand the diagram, you know the diagram, gone. You will not, you can't remember anything. Okay. Next, another diagram is there, very important, where a cut section of the isthmus of the neck is shown at the level of isthmus of the thyroid gland. Okay. Yeah, this I am talking about this diagram. Okay. So this is axial section. This diagram is in which section? See, whenever the diagrams are shown, a particular section is mentioned. Sagittal section, coronal section, axial section, lateral view, right? So which view is this? Axial section. Okay, axial section of the neck. At which level? At the level of the isthmus of the thyroid gland. Now here what you can see, this particular part is the superficial or lateral surface. Here also superficial lateral surface. So see, superficial lateral surface are covered by these muscles. As you can see, sternothyroid muscle is there, sternohyoid muscle is there. This is the superior belly of omohyoid and small part of the sternocleidomastoid muscle. Okay, so you can see these strap muscles are situated anterior to this particular surface. That means these muscles are covering the particular surface of the gland. That's why we are not able to see the gland during the dissection time. So for that, what we have to do? We have to retract this muscle, so we have to remove the muscle, then only we can see the most of the thyroid gland. Okay. Next, I have mentioned in the medial surface already I have shown you the relation. Another important surface that is called the posterolateral surface. Okay, posterolateral surface. Now, can anyone tell me where will be the posterolateral surface over here? In the diagram, can you identify the posterolateral surface? So see, this is the thyroid gland. Okay, this is the thyroid gland. Now, why it is appearing like this? Because it is in an axial section. Okay, this is in an axial section. That's why it is appearing like this. So you have to understand things, that what will be the appearance of a particular structure in all three sections or all three planes. This is the appearance of the thyroid gland in axial section. Okay. Now this will be the posterolateral relation, posterolateral surface. The posterolateral, you can see what are the structures present. Carotid sheath and its content. Okay. So in this diagram, this is anterior aspect, this is posterior aspect. Okay. In the axial view, first of all, you have to identify which is anterior aspect, which is posterior aspect. So in this particular diagram, this is the anterior aspect, this is the posterior aspect. Okay. Now, so if it is posterior aspect, this will be the posterolateral part, right? Now in the posterolateral surface, what is the relation? You can see carotid sheath is present. okay, with its contents. So that is the relation of posterolateral surface. Okay. Next will be the borders. So surfaces are done. Next, borders. How many borders are there? Two borders are there, anterior border and posterior border. Okay. Now here you can see relations of the anterior border and posterior border. First of all, you have to understand that the anterior border separates the medial surface from the superficial surface. So medial surface, now here you can understand easily, okay, this particular surface is the medial surface and this is the superficial surface, okay. See, this is the superficial surface and this is the medial surface. So this superficial surface and medial surface is separated by, this is the anterior border, okay. Now what you can see in the anterior border, can you see a blood vessel? So this is the now here you can see this is the division of anterior branch of superior thyroid artery. Okay, तो superior thyroid artery होता है, just reaching the apex it divides, okay, into anterior and posterior branch. So as you can see, this is the anterior branch. So this anterior branch will follow the entire anterior border, okay, and this side also the anterior branch will be coming and then they will anastomose with each other at the superior border of the isthmus. So that is the relation for anterior border. Next, posterior border. So posterior border will separate the posterolateral surface and medial surface. Okay. So this is the posterolateral surface. This is the posterolateral surface, and this is the medial surface. Okay. So both are separated by the posterior border. Now in the posterior border, two important structures are there. As you can see, these are the glands. Which glands are these? Parathyroid gland. Posterior border, what are the structures present? Parathyroid glands. Okay, superior and inferior parathyroid glands are present. Along with that, I have shown one blood vessels also. Two blood vessels are there. What are those blood vessels? This is the anastomosis between the posterior branch of the superior thyroid artery and ascending branch of the inferior thyroid artery. They anastomose with each other in the posterior border. So these are two important relations of the posterior border. Okay. So entire thyroid gland with its surfaces, borders and relations are completely based on the diagrams. I hope you have noticed that. Okay, next is the relation of the isthmus. So what is present in the isthmus? First of all, it is placed horizontally. Okay, it is covering the second to fourth tracheal rings. Okay, that means जो isthmus है just behind the isthmus, or you can say deep to the isthmus, second to fourth tracheal rings are present. Okay. Next, the isthmus is having two borders and two surfaces: superior border, inferior border, right? And anterior surface and posterior surface. That's it. These are for the isthmus. Now, what are the relations of the superior border and inferior border? Okay. First of all, you can see the anterior surface strap muscles are there. That is the sternohyoid and sternothyroid, which is overlapping the anterior border. Okay. Anterior surface and anterior jugular veins are also there. Anterior jugular vein mainly situated superficially, but it is crossing the anterior surface. Next, posterior surface is related to second, third and fourth tracheal rings. Already I have told you, posterior surface is crossing the second to fourth tracheal ring. Next, superior border, already I have shown you, there will be anastomosis between the two branches of the superior thyroid artery. Okay. And inferior border, the veins which are leaving the thyroid gland mainly arising from the inferior border of the isthmus, and along with that occasionally a artery is present that is called as thyroidea ima artery. Okay, in some case it is present. Now here you can see the relations of the isthmus. Can you see the isthmus? See, this is the isthmus. Okay. Now here you can see it is covered by the strap muscles. You can see over here sternothyroid, and you can see sternohyoid muscle. So these muscles are covering the isthmus from the anterior aspect. So this will be the relation of the anterior surface. Okay. Posteriorly you can see the tracheal rings. ये देखो इसके पीछे tracheal rings दिखाई दे रहा है. So which tracheal rings will be present? Second, third and fourth tracheal rings are present posterior to the isthmus. So that will be the relation for anterior surface and posterior surface. Okay. Next, see, this is the superior border. So in the superior border, you can see the anastomosis between two arteries, two branches, two anterior branches of the superior thyroid artery. That is present in the which border? Superior border. Inferior border, as you can see in the inferior border, the veins are leaving the thyroid gland, and occasionally a artery is present that is called as thyroidea ima artery, which in most of the cases it occurs from the arch of the aorta. It is a variation. Okay, thyroidea ima artery in 35 to 40% of the cases this artery is present. If this artery is present, it is arising mostly from the arch of the aorta. It is a variation, not normal. Okay. So these are the relations of isthmus. Okay, so along with that, the surfaces, borders, relations are over of the thyroid gland. Okay. Next is the blood supply. Why blood supply is important in case of thyroid gland? Because in the beginning I have told you it is the endocrine gland having rich blood supply. Okay. So what do you think? What will be the blood supply of thyroid gland? Do you remember the branches of external carotid artery? Which is the first branch of the external carotid artery? Yes, superior thyroid artery. So the name suggests superior thyroid artery. That means it will supply some part of the thyroid gland. Okay. Now, as I have shown, it is such a huge gland. So one source is not enough to supply the entire gland. That's why two arteries are there. One from above, another from below. Okay. And then they supply the artery. And along with that, some additional or you can say reinforcement branches are also there. Okay, which supplies the gland. Now, in the arterial supply, mostly it is supplied by superior thyroid artery and inferior thyroid artery. Okay, superior thyroid artery is a branch of external carotid artery. Okay, and inferior thyroid artery is a branch of thyrocervical trunk, which is the branch of first part of the subclavian artery. Okay, so superior thyroid artery branch of external carotid artery and inferior thyroid artery branch of thyrocervical trunk. Okay. And as I said, additional blood vessel is also there, that is called arteria thyroidea ima. Sometimes it arises from the brachiocephalic trunk or arch of aorta, which supplies the isthmus. But this is occasional. Every time it is not present. And next, as I said, some additional branches or reinforcement branches are also there. For example, it is derived from esophageal branch, tracheal branches, which supply the gland. Okay, on the medial surface. Now those particular branch will ramify around the stroma of the thyroid follicles as fenestrated capillaries. And why fenestrated capillaries are important, we have discussed in histology. Okay. So now we will see about each and every artery, superior thyroid artery, inferior thyroid artery. Why? Because those arteries are related with an important nerve. Okay, both the arteries are related with an important nerve. Okay, with the important nerve. That's why we have to know about the codes of each and every artery. So first is the superior thyroid artery, which is a branch of the external carotid artery. So after origin, it will descend, okay, downwards and forwards with the external laryngeal nerve. So this is the relation. So after origin, whenever the artery is descending, okay, downwards and forwards, it is accompanied by a nerve. Which nerve is this? External laryngeal nerve, okay, which is a branch of vagus. Now, when it reaches near the apex of the lateral lobe, the nerve will leave the artery. Okay, up just adjacent to the apex, it will accompany the artery. Beyond that, it will leave the artery, and the course of the nerve is different. Okay. Next, when the artery reaches the apex of the lobe, it will divide into anterior and posterior branches. Anterior branch, as we have seen, it will pass through the anterior border, okay, and will anastomose with the branch of the opposite side. Posterior division, what it will do? It will go in the posterior border and then it will anastomose with the ascending branch of the inferior cervical artery. Okay, that is the course of the superior thyroid artery. Now the superior thyroid artery supplies the upper 1/3 of the lobe and upper half of the isthmus. Okay, now here you can see, so this is the superior thyroid artery. So this is the external carotid artery. Now see, this is the superior thyroid artery. Now the superior thyroid artery is going downwards and forwards. When it is going downwards and forwards, it is accompanied by external laryngeal nerve. Okay. Now when it comes near the apex, the nerve will leave the artery, and this artery will divide into two branches, as you can see in the diagram. Okay. So this is the posterior branch and this is the anterior branch. Okay. So as you can see, anterior and posterior branch. Now this anterior branch is anastomosing. So this side and this side, the anterior branch will anastomose with each other at the superior border of the isthmus, and posterior one you can see it is anastomosing with the inferior thyroid artery, as you can see, inferior thyroid artery. Okay. So inferior thyroid artery is left, that will continue in the next class. Thank you.